Anas Rahim, D.O., is a Texas-based clinical attending in a pain management fellowship program who has mastered the art of blending competence with a lifelong commitment to service. Born in 1990 in Atlanta, Georgia, Dr. Rahim moved with his family to Panama City, Florida, where his father established a medical practice. His parents, who fled political persecution in Syria during the 1980s, instilled in him values of hard work, faith, and family, principles that guided him as the youngest of 5 siblings. By high school, he was already dual-enrolled at Gulf Coast State College, serving as community service chairman and spearheading initiatives like Adopt a Highway and Habitat for Humanity projects. His undergraduate years at the University of Florida deepened his passion for service. Majoring in food science and human nutrition, he graduated in 2012 while leading Project Downtown, a Muslim values-based group aiding Gainesville's homeless population. As treasurer, he helped it become a 501(c)(3) nonprofit, expanding meal services and partnering with local coalitions to support job placement for the unhoused. These experiences laid a foundation for a life of impact. Medical school took Anas Rahim, D.O., to West Virginia in 2013, where he encountered snow for the first time and quickly decided cold climates weren't for him. A life-changing moment came in 2014 during a medical mission trip to Syria amid its civil war. Working in a bombed-out hospital's emergency room, he witnessed the chaos of war firsthand. Assisting an anesthesiologist in the and operating room, he found his calling in anesthesiology, drawn to its ability to manage pain and stabilize patients in crisis. Returning to the University of Florida in 2017 for his anesthesiology residency felt like a homecoming. But in his second year, he faced a major physical setback, a herniated cervical disc that required surgery after he lost function in his right arm. Through this period, the unwavering support of his wife, Jinan Erkid, was instrumental. Her steadiness helped carry him through recovery, and together they navigated the challenges of residency while preparing to welcome their first son. Recently, he shared insights into his approach to patient care and mentorship. As a clinical attending in pain management, how do you approach mentoring fellows and early career physicians? Having only completed my training 4 years ago, I vividly recall what things I did and did not appreciate as a trainee physician. I worked towards building on the things I liked about my attendings and worked to eliminate qualities that were tough for me to deal with, like throwing trainees under the bus. One of the most important qualities a good mentor has is being approachable and non-intimidating. How has your approach to mentorship evolved, especially after navigating personal and professional challenges? Everyone's circumstances are unique. Don't judge a situation until you've had time to gather all the details, and once you have, take some time to think about it. Mentoring someone is a privilege, and you want to avoid giving impulsive advice to help those who seek it. In what ways has mentoring others contributed to your own development as a physician and educator? Mentoring, most importantly, deepens knowledge. In order to share knowledge, you want to make sure you're truly knowledgeable before sharing. It also allows an opportunity for self-reflection. Guiding others often makes me more introspective about my own practices and decisions, and I critically evaluate myself. What do you look for in trainees that signals a readiness to grow and benefit from structured mentorship? It sounds simple, but learning from information that's being shared. It starts with learning, and once what's learned is implemented into practice, it suggests a readiness to grow. You also look for someone who takes accountability for mistakes and sees them as an opportunity to grow as opposed to trying to cover up the mistake. Throughout your medical journey, who has had the greatest influence on your approach to patient care and professional growth? My mentor during my residency training, Dr. Goldstein, a cardiothoracic anesthesiologist at the local VA, was instrumental in my professional growth and my interactions with patients. He was not only great at communicating to the residents how to act, but he was even better at playing the part of his patients, treating our veteran patients with respect, dignity, and compassion, all the while being a great role model to his students. And an important addition is a tenet of my faith that states, "Do unto others as you would like done unto you." I feel that if I follow this basic principle, I'm always able to make sure I'm doing the right thing for my patients. Is there a piece of advice or a moment in training that reshaped your perspective on medicine or leadership? In medicine, learning from others' mistakes is a huge part of growth and becoming a better clinician. One story that comes to mind from healthcare professionals' experiences is about a medical resident who observed a senior physician misdiagnose a patient with severe abdominal pain as having gastroenteritis. The patient was later found to have a ruptured appendix, which led to significant complications. What struck the resident wasn't just the mistake itself but how the senior physician handled it afterward. Instead of deflecting blame, the physician openly discussed the mistake with the team, emphasizing the importance of keeping a broad differential diagnosis and not anchoring on a single explanation too early. That moment reshaped how the resident viewed mistakes, not as failures but as critical learning opportunities. It also reinforced the value of humility and transparency in practice. What have you found to be the most effective ways to build meaningful, growth-oriented relationships with mentors and mentees? Put the interest of the mentee at the forefront of the relationship. You also want to cultivate a culture of honest, constructive feedback. Growth happens when both parties feel comfortable discussing strengths and areas for improvement. The most transformative mentorships come from being willing to question assumptions and openly discuss failures without fear of judgment. When seeking guidance, what personal or professional traits do you value most in a mentor? Speaking honestly and candidly. It's important to have tact when communicating about difficult topics from a superior, but I personally prefer to hear the reality of a situation rather than a sugar-coated version. Also, I appreciate when a mentor takes the time to understand your perspective and challenges, offering advice that's tailored rather than generic. What do you find most fulfilling about guiding future pain management specialists through fellowship or clinical work? Guiding future pain management specialists is incredibly fulfilling because it's not just about teaching techniques but also about shaping compassionate, thoughtful clinicians who can truly make a difference in patients' lives. Contributing to the next generation of pain management specialists helps ensure that the specialty continues to grow, evolve, and maintain high standards of care. The most gratifying moments are when former trainees reach out after graduation, sharing how they applied lessons learned during the fellowship to make a meaningful impact on a challenging case. It's a very proud feeling. What's next for Anna's Rahim, D.O.? Anna's Rahim, D.O., stands out as a physician whose journey reflects resilience, dedication, and a deep-rooted commitment to serving others. His path through medicine offers a compelling story of growth and impact. Outside the clinic, Dr. Rahim finds his greatest joy at home with his wife, Jinan Erkid, and their children. Whether it's sharing family dinners or weekend beach outings, their bond is the heart of his world. With 18 grandchildren among his parents' brood, the tight-knit family remains a pillar of support. As Anna's Rahim, D.O., looks to the future, he remains focused on advancing pain management through innovation and education. With a third son on the way, he plans to deepen his family roots in their new Texas home while refining fellowship training and integrating new techniques to improve patient outcomes. Beyond medicine, he hopes to inspire his children with the same values of service and resilience that guide him. Whether mentoring the next generation or enjoying beach days with loved ones, his journey reflects a blend of purpose and promise.